Hello everyone. Hello everyone. I'm Dr. Sundaram. So today we'll be talking about the question which was asked in the Central Loksewa 2082 for medical officer post 8 level on the Nepal Health Service. So exam date was 4/5 by SARC 2083. So now moving to the MCQ question, multiple choice question of Lok Sabha 2082, Central Loksewa 2082. Which of the following is the first step in the management of patient? So first question is, which of the following is the first step in the management of the patient suspected myocardial infarction? Myocardial infarction. So options are administered PPI, proton pump inhibitor, perform immediate catheterization, start IV fluid, and other is administered aspirin. Aspirin. So most suitable option will be administered aspirin. Next question number 2. Most cardiotoxic local anesthetic agent is option are lignocaine, bupivacaine, pirocaine, procaine. So which is the most cardiotoxic local anesthesia is bupivacaine. The earliest radiological change seen in the case of acute osteomyelitis is option A, bony sclerosis. So earliest radiological change which is seen in osteomyelitis. So option A, bony sclerosis. C, terrestrial reaction. Or the sequestral formation. D. B is loss of plane between soft tissue and muscle. Loss of plane between soft tissue and muscle is the correct answer. In transverse fracture, question number 4. In transverse fracture of the patella, the treatment is option A, wire fixation. B, plaster cylinder. C, patellotomy. D, excision of small infarct. So option A, wire fixation is right. Pathological fracture of bone means, question number 5. Pathological fracture of bone means A, fracture beneath suture wound. B, a comminuted fracture. C, a fracture along the bone with secondaries. D, a fracture involving more than one bone. So a fracture along the bone with secondary is the right answer. So question number 6. A 27-year male patient in road traffic accident fractured femur. After few days he came to the ER. Which fracture? RTA, femur fracture. After few days he came to the ER with complaint of chest pain. And what do you suspect? So after few days we suspect. So options are normal chest pain, B, heart embolism, C, amniotic fluid embolism, D, or the cardiac pain. So answer will be heart embolism. Question number 7. Which of the following diseases is rarely seen since last decade? So A, TB spine, B, osteomyelitis, C, poliomyelitis, D, septic arthritis. So which is rarely seen in the last decade? Answer will be poliomyelitis. Which are the following? 8 number question. Which are the following is a laughing gas? Options are carbon dioxide, next NO2, carbon dioxide, NO2, nitrogen dioxide, nitric oxide, and B2O. Answer will be laughing gas is N2O, nitric oxide. Question number 9. Unexpected and unusual laboratory test is common in A, dormant stage of disease, B, common event, C, patient under report of his problem, D, sample labeling error. So answer will be sample labeling error. D, question number 10. In which of the following condition is the formation of granuloma most commonly seen? A, rheumatoid arthritis, B, tuberculosis, C, myocardial infarction, D, liver cirrhosis. Option B, tuberculosis will be the right answer. Most common cause of granuloma formation. So following vaginal delivery, the uterus no longer palpated on abdominal examination. by 6 weeks postpartum, by 1 week postpartum, by 24-hour postpartum, by 2 weeks postpartum. So how no longer the uterus is like palpated? So answer is B, that is by 2 weeks postpartum. 12 is prerequisite for the forceps delivery include all of the following except a commonly dilated cervix, A, B, an empty bladder, C, vertex in occiput anterior position, D, ruptured membrane. The answer in forceps delivery, the prerequisite will be all except vertex in occiput anterior position, except. Question number 13. The active stage of labor is after full dilatation, B, from 4 cm dilatation up to 4 cm dilatation, none of the above. Answer will be from 4 cm dilatation. From 4 cm dilatation. Question number 14. A pregnant woman 25 weeks presented in hospital with hypertension and proteinuria. What is the most likely diagnosis? A option is so pregnant woman of 25 weeks of gestation 25 weeks presented with hypertension and proteinuria. What is the likely diagnosis? Option A chronic. So here hypertension and proteinuria. Pregnant woman. So option A chronic hypertension, B gestational hypertension, C preeclampsia, D eclampsia. Option C preeclampsia will be right. Question number 15. Early detection of breast cancer is important for the treatment. Which simple screening method accepted widely? Screening method. It is not the diagnostic method, a screening method. So option A self-examination of breast, mammography, FNAC, and periodic checkup by a surgeon. The most appropriate answer will be A self-examination of the breast. Self-examination of the breast. Question number 16. Which of the following is the most common cancer among female in Nepal? Option A stomach cancer, B rectal cancer, C cervical cancer, D breast cancer. Common cancer in female is cervical cancer. 17. Which is the leading cause of maternal mortality in Nepal? A obstructive level, C eclampsia, C antepartum hemorrhage, D postpartum hemorrhage. Obviously postpartum hemorrhage is the right answer. Question number 18. Bishop score is used to assess fetal well-being. B risks of preterm labor, C cervical favorability for induction of labor, D amniotic fluid index. The answer will be cervical favorability for induction of labor, Bishop score. Question number 19. A 21-year-old woman presented with vaginal discharge and itching, examination yellow greenish discharge with the strawberry cervix. What is the likely diagnosis? Is trichomoniasis. Question number 20. At what gestation age is the fetal anomaly scan typically performed? So 12 to 14 week anomaly scan. Which scan anomaly? 12 to 14 week, 20 to 22 weeks, 24 to 28 weeks, D is 30 to 36 weeks. Answer will be 20 to 22 weeks. 21. Exclusive breastfeeding for newborn baby means feed only breast milk or lactogen milk, milk with other food, breast milk plus cow milk. Option A breast milk only feeding will be the answer. Question 22. Infant body weight is tripled by the age of option A 5 months, B 1 year, C 15 months, D 2 year. The option B, that is 1 year, will be the right. Question number 23. The mechanism of hypokalemia in emesis is mainly due to A gastric loss of potassium, B gastric loss of hydrochloric acid, C low aldosterone, D dehydration. The mechanism of hypokalemia in emesis is mainly due to hypokalemia due to gastric loss of hydrochloric acid will be the right answer. Question 24. The number of chromosomes in Turner syndrome is, there is one pair of extra chromosomes. So A 44, B 45, C 46, D 47. The answer will be 45. 25 number question. The commonest cause of emesis in children is A spina bifida, B urinary tract infection, C psychological stress, and D. Diabetic mellitus. Obviously, the answer here is psychological stress. Question 26. Which are the following characteristic feature of the measles rash? A. Vesicular rash. B. Petechial rash. C. Maculopapular rash starting on the face and spreading downward. D. Erythematous rash with central clearing. The answer of measles rash, characteristic feature of measles rash will be maculopapular rash starting on the face and spreading downward. Moving to the question 27, which is the standard treatment for vitamin A deficiency under 5 children? A option, vitamin A 2 lakh start, repeat in 1 week. B, vitamin A 2 lakh start, repeat in 2 weeks. Vitamin A 1 lakh start, repeat in 2 weeks. 1 lakh start, repeat in 1 week. The answer will be 2 lakh start, repeat in 1 week. Which are the following treatment? Question 28, which of the what is the first line treatment based on national protocol for pneumonia among under 5 children in peripheral health facility? So, pneumonia. The most common drug is amoxicillin used. Amoxicillin, cotrimoxazole, and chloramphenicol and ciprofloxacin. The answer will be amoxicillin. Which are the following? Question 29. Which of the following is not a cyanotic congenital heart disease? A teratology of Fallot. A. Then we have transposition of great vessels with the arterial septal defect, total anomalous pulmonary venous return. So answer is arterial septal defect. And D, which is the most common age group affected by rheumatic fever? A, infant 0 to 1 year, toddler 1 to 3 year, C, children 5 to 15 year, adult 20 plus. So rheumatic fever age group affected children 5 to 15 years. Which method is appropriate to promote ORS use in communities? A, demonstration. B, role play. C, brainstorming. D, group discussion. So demonstration will be the right answer. The constant presence of a disease or infectious agent within a geographical region is known as A, epidemic. B, episodic. C, sporadic. D, endemic. The answer will be endemic. Which is your first action in outbreak of diarrheal disease in a community? Outbreak of diarrheal disease. So A, supply of ORS, quick mobilization of medical resources, improvement of personal hygiene, sufficient supply of antibiotic and IV fluid. So supply of ORS. Question number 34. The diet recommended in high altitude diet is high protein diet, high fat diet, high carbohydrate diet, low carbohydrate, high protein diet. High carbohydrate diet is the right answer. 35. Which is the best determinant of health status of a country? Youth birth rate, infant mortality rate, maternal mortality ratio, and contraceptive prevalence rate. So answer will be the infant mortality rate. Post-exposure vaccine is given to post-exposure: typhoid, mumps, rabies, rubella. Answer is rabies. In water dehydration solution, the concentration of the sodium chloride is 3.5 gram, B 3.6 gram, C 2.5 gram, D 1.5 gram. Answer will be 2.5 gram. The primary responsibility of medical officer in healthcare setting is question 38. Conduct research on new medical technology, provide direct patient care and medical treatment, administer whole hospital administrative tasks, manage hospital finances. Answer will provide direct patient care and medical treatment. The most common aspect of effective communication between a doctor and a patient is A, using medical jargon, persuasion skill, active listening, providing detailed instruction. So answer will be active listening. Question number 40. The minimum per capita water requirement for domestic use recommended by WHO is 20 liter per day, 50 liter per day, 70 liter per day, 100 liter per day. So answer is 50 liter per day. Question 41. Radiological sign of fatal death include all except overlying of skull bone, collapse of spinal column, hyperextension of spine, and gas in aorta. Okay, so answer is hyperextension of spine. Then question 42. Lower end of the femur can be helped to determine the following: height, B age, C stature, D weight. So age. Question 43. Immediate sign of death is fall in body temperature, dilatation of pupil, change in skin, cessation of respiration and circulation will be the answer. Which are the following is used to estimate the time of death? Blood and alcohol level, rigor mortis, hair length, temperature of the body. Answer will be rigor mortis. Question of 45. Which is the typical cause of death in person who is victim of hanging? A. Heart failure, B. Asphyxiation, gunshot wound, D. Sepsis, hanging. So obviously asphyxiation. Question 46. Question 46. Disciplinary control over the registered medical practitioner is under A. Ministry of Health and Population, Nepal Medical Association, Nepal Medical Council, Public Health Service Act and Regulation. So answer is Nepal Medical Council. A health worker who violate Milk Substitution Act, shall be pursued with the following imprisonment: a fine not exceeding 1,000 or imprisonment of a term not exceeding 1 month or both will be the right answer. Next, question number 48. Which act regulate the health personnel and health worker under Ministry of Health and Population? So answer will be Health Service Act. Other options are Health Professional Act, Health Personnel Council Act, Medical Council Act. The main objective of the Organ Transplantation Act in Nepal is to regulate option A, sale of human organ, B, promote organ donation internationally, D, control the illegal trade of organ and establish ethical transplant practices, D, establish central bank for storing human organ. So the objective is to control the illegal trade of organ and establish ethical transplant practice. D. So question number 50. Into the right of safe motherhood and reproductive act, which is authorized to legal abortion. So A, only licensed doctor, only government certified health worker, any healthcare provider, only traditional healer. So answer will be only government certified health worker. 51. Which maneuver typically are not performed early before chest compression in basic life support outside the hospital? A, call for help, obtain airway, maintain proper ventilation, electric cardioversion. So maneuver which is not performed is electric cardioversion. 52. Question 52. Rectal examination cannot provide information about A, sphincter tone, B, rectal urethral rupture, C, pelvic examination, D, scalp fracture. Answer B, urethral rupture. Which of the following is important aspect to transport suspected spine injury case to referral center? Primary treatment of shock, appropriate first aid treatment, open vein and fluid on the way, immobilization of spine. So basically in spine fracture, immobilization of spine will be the correct answer. Question 54. A man is having severe diarrhea and vomiting now developed leg cramp after receiving IV fluid dextrose. So what will be the answer? Dextrose line. He is having option A, hypokalemia, B, hyponatremia, C, hyperkalemia, D, hyponatremia. The right answer will be hypokalemia. 55. What is the first step in managing a patient in cardiac arrest? A, administer epinephrine, start chest compression, check for responsiveness and pulse, defibrillate immediately. So check for pulse and responsiveness. Question 56. All the following drug belongs to the antipsychotic except A, haloperidol, B, colchicine, C, chlorpromazine, D, fluoxetine. Answer is D, fluoxetine is the antidepressant. Question 57. Untoward effect of chloramphenicol is A, dizziness, B, headache, C, bone marrow suppression, D is immunity suppression. So answer is bone marrow suppression. What is the standard treatment of anaphylaxis reaction? What is the standard treatment of anaphylaxis reaction? So option A is antihistamine injection, B steroid injection, C adrenaline injection, D steroid and antihistamine injection. Answer is adrenaline injection. So 59 question. The one the drug administered through the layer of the skin into the areolar tissue, it is called A intradermal administration, C intraarterial administration, B intramuscular administration. Answer B subcutaneous administration. 60-year male or 60-year-old man with a history of heart failure reduced ejection fraction started on a drug to improve his symptom. The drug inhibits the sodium potassium pump, leading to increase in intercellular calcium. Which of the drug is given? Digoxin. Question 61. Which of the layer of epidermis contain melanocyte is stratum basale contain melanocyte? Other options are stratum lucidium, stratum spinosum, stratum granulosum. Question 62. All of the treatment are moderate to severe acute acne vulgaris except so isotretinoin is treatment, carbon dioxide laser and microdermabrasion, UV phototherapy and PDT. So answer is calcipotriol. Question 63. Which is the treatment of genetic infection in case of AIDS? So standard antiviral treatment, B broad spectrum antibiotic, C systemic steroid, D clotrimazole. So opportunistic organism. So answer will be clotrimazole. So 64. Most common cause of non-gonococcal urethritis (NGU) is A virus, B chlamydia trachomatis, C trachomonas vaginalis, D fungus. So answer will be trachomatis. Which question 65. What is the most common site for atopic dermatitis in adult? A face, B flexure area, palm and scalp. So answer is B flexure area. Question 66. False perception without external stimulation is known as hallucination. Not illusion, delusion or obsession, it is hallucination. Question 67. Which is the most common presentation of depression? Is insomnia. Which of the following is therapeutic is benzodiazepine, is anxiolytic and sedative effect? A person presented in the ward when asked what is your name in the same manner and what is the phenomenon called echoalia. Which of the following treatment is organic brain disease resulting in damage to the memory body? Mental status. A Wernicke-Korsakoff syndrome. Which blood test is useful for test for presence of diabetes in every world? So venous ABGA complex. Which is 72. Which is the longest organ of digestive system in human body? Is small intestine. 73. Pulmonary eosinophilia is caused by all except Plasmodium vivax. Which subtype of influenza A is causing bird flu? Is H5N1. So gastric cancer is strongly associated with which of the following? Yes, pylori. 76. Which neurotransmitter is primary in Alzheimer's is acetylcholine? Yes, so we have which of the most important degenerative condition among older people is osteoarthritis. Nephrotic syndrome is characterized by all of the following except RBC cast in urine. Most accurate tests to detect infection caused tuberculosis is sputum for EFD, which is the tropical disease known as breakbone fever, dengue fever. 81. A patient with obstructive jaundice due to pancreatic carcinoma might have all of the following clinical findings except pain early in the course of the disease. The most common site of volvulus in adult is sigmoid colon. Which of the following is the primary imaging modality? Gallstone is ultrasound. Next we have 84. Which of the following indicate carcinoma of breast is recent retraction nipple? 85. Primary closure of incision must be done within 6 hours. Morphine tried is pain, vomiting, fever. 87. The commonest cause of pulmonary insufficiency early post-abdominal surgery is atelectasis. Vasectomy is done in camp setting. Which is the common cause of liver access in Nepal based on the hospital experience? Is amoeba. 90. Which is the complication of long-term antibiotic administration in lung opportunistic infection? 91. Which occupation has More chance of eye injury is farmer. 92. Slant chart is used to assess visual acuity. The confirmation diagnostic cornea also is positive fluorescence test. 94. Which is the leading cause of blindness globally is cataract. Which one is the vaccine preventable disease is diphtheria. 3-year-old child have nasal discharge, foul smear, what to suggest foreign body. There is a hoarseness lasting for more than 3 weeks to develop to which of the following is a common complication untreated is abscess formation, which is the preferred management pyogenic granuloma, a surgical excision. Next one is a 60-year-old man pointing to the yellowish of the skin, person dental cleaning need to be done. Talking about the subjective question, section A, there are the main signs and symptoms of type 2 diabetes matter. How to confirm the diagnosis? Urticaria, similarly emergency coma state. Section B, intestinal obstruction, epistaxis, and general anesthesia. In section C, they present about any hypotensive. Similarly, proteinuria, malnutrition. Here, motherhood program of Nepal, and section D, abortion law was asked. So this much in today's videos.